in Mumbai and Pune. He has an experience of more than 7 years in the treatment of numerous urological problems. He has done his master's in general surgery from the prestigious Grant Medical College and JJ Hospitals, Mumbai, which has produced many eminent surgeons. He has completed training in urology from Topiwala National Medical College and BYL Nair Hospital, a renowned super specialty tertiary healthcare hospital in Mumbai. He is a meticulous surgeon, a keen learner, and is up to date with all the new advancements in the field of urology. He has also he has also undergone fellowship training in robotic uro-oncology at Kokilaben Dhirubhai Ambani Hospital and Medical Research Center, Mumbai. He specializes in robotic assisted urological surgeries, laparoscopic urological surgeries, urological oncology, and laser urological surgeries. Dr. Varun is also actively involved in various medical camps organized at local and national levels. He has been projecting his work through numerous papers and talks at various national and international conferences across the country. Currently working at his own setup in Vashi as well as visiting Aditya Birla Hospitals, Pune for robotic surgeries. You can follow him on LinkedIn. The link for the same has been shared in the chat window. Without wasting much time, I now hand over the platform to Dr. Varun. Over to you, Doctor.
Thank you, Mr. President. Thank you for the kind introduction. At the outset, let me just say it's a pleasure to be here. I feel thank HR Association of India for giving me this opportunity to be speaking about various urological problems which are affecting us these days. March being a month which is dedicated to women, Women's Day celebrated in March. This is a very good collective initiative by HRAI that they approached me and they said that we should speak something about women's health. So I will try to keep my talk limited to urological problems in women mainly. And I will be speaking in general about other urological problems as well, but I'll be concentrating more towards women in my talk. So Mr. Faisal really gave a good introduction. I'll also just say a few words that I'm Dr. Varun Agarwal, practicing in Vashi and Pune as well. And I'm a urologist, uro-oncologist, and a robotic surgeon. Basically, when you say urologist, I deal with kidney, bladder, prostate problems, stones, cancers of urinary tracts, and I do all the surgeries related laparoscopically as well as robotically. So not wasting any much more time, I think let's just move ahead. I'll be broadly covering a few things today. Let me just give a gist. I don't have any PPT which I want to show you because I feel it is better if we have a dialogue. If you hear me speaking rather than seeing the PPT, which sometimes gets too boring. So I just thought I'll just speak out whatever is there, whatever. I mean, I want to keep it very simple and I'll speak in very simple words. If someone wants, I can speak in other Hindi or Marathi as well, if that is needed. But I believe speaking really helps rather than seeing it on the screen. That is why I'm here only speaking today and I'm not presenting anything as such. So my topic, basically, I'll be speaking about urinary stones. Firstly, stones, management of stones, why do they occur and how to prevent them, kidney stones. Next, I'll be talking about infections in women because urine infections in women are extremely common. So I'll be speaking about infections. Thirdly, I'll be speaking a little bit about cancers that are affecting our urological cancers mainly in our people. So let us start with the stones, kidney stones, very common problem in India. Obviously, there are different types of stones. I'm sure you must have heard calcium stones. Mainly, the commonest ones are calcium oxalate stones that we have. Apart from that, there are uric acid stones, cysteine stones. So they're all very rare variety of stones, frankly. The commonest ones are the calcium oxalate stones. Why do these stones occur? This is a very common question that everyone has. Once if you have a stone again and again, why does it occur? So frankly, the answer to this is that the the climate of India, climate where we stay, is a bit warm. There is always a insensible water loss from our skin. Even if we are breathing, we are exhaling our water vapor. So water is getting lost from our body. So, as a result, there's dehydration in our body, and that leads to stone formation. So places which are more warm, there are high chances of stone formation. So, and we don't drink enough water. Secondly, there must be small infections in our urinary tract. So all these things together, they lead to stone formation. Some patients have a tendency to have increased infection, due to which they have increased incidence of stones in them as well. And then there are certain dietary factors that contribute to stone formation. I can't say that diet 100% is responsible for stones. That is never the case. It is always that they are a contributory factor, along with many other factors like dehydration, sunlight, excessive warmth. So, like, these are the causes of stone. What are your symptoms? Usually, stones, when they're present in the kidney, they're small stones. If they're small stones, they do not cause any problems. They may be asymptomatic for many years also. Sometimes when they grow big or they come down into a tube which is there below the kidney, that is the time when pain really occurs. Patient comes with a lot of pain, and then we have to start him or her on medications, and that's what relieves the pain. Sometimes the pain does not get relieved, so there are other means and methods to treat them. So pain is the commonest symptom. Secondly, if the stone is there since a very long time, it can also lead to prolonged damage of the kidney. Patient does not realize that he has a stone. It may not have been pain, but over a period of time, the kidney gets damaged. So it becomes non-functional over a period of time. So that is a problem. Then it leads to infections. That is another symptom of stone. Recurrent infections, that is also a sign of stones in the urinary tract. How do we diagnose it? Diagnosis is simple. Usually ultrasound, that is a sonography of the abdomen, is usually done. That shows what is the size and location of the stone. To prove it in a much better way, we have a CT scan. CT scan tells us exact size, site, location, and number of stones as well. These are the two main investigations that are done. And how is it treated? Treatment largely depends on where the stone is exactly, in the bladder or in the kidney or in the tube below the kidney. So nowadays, most of the time, 99% times, the treatment is by endoscopic means. Now, when I say endoscopy, it means that it's only you done with the help of a camera, a scope. In layman's words, I can say laser. Like, patients always ask us, laser se hoga kya? So yes, laser se hona, that means endoscopically hona. That means it will be stitchless, it will be bloodless, and there won't be any incision on the body. Sometimes, very rarely, there is a need to take incisions on the body when there's a huge stone, and endoscopic means may not help in such cases. So treatment, this was fairly about the treatment. There are different kinds of surgeries. I don't think I need to go in depth about the surgeries. But the most important thing about stones, I'm sure you all have that in your mind, is how do we prevent it? Stone nahi hone ke liye hum kya kare? This is what everyone asks. So there are a few things that I usually ask my patients to follow. Most important is water consumption. Extremely important. I told you initially that minimal amount of infection in the urine, it leads to stones. So we want the infection to be flushed out, right, from our body. That is why we need to have water very frequently. Water consumption is absolutely vital for stone prevention. Next is salt intake. Usually we must restrict salt intake. Those who are recurrent stone formers, salt anyways, we say we must restrict it because of it has an effect on the heart as well. So restricted salt intake up to around less than 4-5 grams a day is enough. That's how that is what is prescribed for stone prevention. You must avoid too many caffeine related products. Similarly, products which have a lot of phosphate in them, like cola drinks, all these soft drinks, beverages that we have, they have high phosphate levels. So we also advise our patients to avoid these drinks. Amongst the foodstuffs, we must try and avoid things with red meat, which involves poultry, fish, pork, chicken. So, red meat, it leads to stone formation. Next, I think the calcium part, we all think that, stones are made of calcium. So calcium levels, if they rise, it will lead to stone formation, which is true. High calcium levels can cause stone formation, but low calcium can also cause stone formation because of the body metabolism. So we must have an adequate amount of calcium in the diet. So diet which is rich in calcium, like curd, buttermilk, yogurt, these things can be used. At the same time, diet which is deficient in oxalate is important. That means we must avoid diets which are high in oxalate, right? So which are the diets high in oxalate? Usually dark chocolate, black tea, cashew nuts, groundnuts, peanuts, spinach, potato, soybean. These are the things which are quite high in calcium, in oxalate. So we must kind of avoid it. At the same time, we can consume products which are low in oxalate. So when you say low oxalate, it includes egg, rice, apple, grapes, cauliflower. These are the things which are low in oxalate. So we must concentrate more on these foodstuffs and avoid the diet which has high amount of oxalate in it. Next is we must avoid too many vitamin supplements in our diet because they also ultimately lead to stone formation. So all in all, I believe the most important thing is adequate water consumption and along with certain dietary changes and treatment of urinary infection as soon as possible. If you have an infection, make sure you're drinking a lot of water so that the infection gets flushed off and the small sediments, particles that ultimately form the stone, they are also flushed off with increasing amount of water. So this was about the stones. I'm sure that a lot of people have this doubt about how can we prevent stone formation. I know still people will ask me this question. So I have tried to cover as much as possible about the stones in this. Next, we'll move on to infections. So urinary tract infections, basically it's simple. An infection that is a microorganism, any organism inside our urinary tract, it causes an infection. Now, why does infection occur? Frankly, I'll be concentrating more on women-related talk right now because infection in males is not as common as females. Now, there's a reason for it. The reason is the urinary tube in females is extremely small, and the urinary opening in females is very close to the anal opening, the opening from where motion is passed. So as a result, the bacteria in the motion, it very easily reaches the urinary opening in females. In males, that is not the case. So females have a very high tendency of urinary tract infections. This is what are the causes of urinary infections? Really, improper hygiene is one of the most important reasons. Drinking less amount of water. Again, like I said before, less water always causes problem with the urinary tract. So improper hygiene, having less amount of water. Some patients having uncontrolled diabetes. Diabetes can lead to infections anywhere, and urinary tract infections are the commonest in patients with diabetes. In females who have an increasing age, that means who are post-menopausal, after their menopause, the area around the urinary opening, it becomes dry, and that leads to more and more infections. So in them, people of higher age, women of higher age also have high chances of infection. Sometimes there can be obstruction in the urinary tract, like any stone or even a tumor, even that can cause infection, or sometimes the uterus may come down, it's called prolapse. That may obstruct the urinary tract and that may cause an infection as well. The commonest, amongst women also actually, the commonest class of women who come to me for infections are young sexually active females, especially after intercourse. There is a very high chance of developing infections. So there are a few ways and means of preventing it, which I will be covering subsequently in my discussion. So these are broadly the causes of infection. Now, how would you know that you have a urine infection? This applies to males as well as females. If you'll have burning in urination, you'll have increased frequency. That means you'll have to go again and again to pass urine. And there will be, whenever you go to pass urine, there'll be very few drops coming out and they will actually burn you a lot. There'll be pain in the lower half of the abdomen. Sometimes there can be fever as well, and fever with chills. That means you may have shivering along with it as well. How do you diagnose it? Diagnosis is pretty simple. Simple urine tests, urine culture, and urine routine tests. By the help of culture tests, we come to know if what is the organism that is affecting it and what is the antibiotic that will help it. This also we come to know with the help of a urine culture. Apart from that, we do a sonography usually just to rule out if there's anything else in the urinary tract, like I mentioned, stones or a tumor, or is there any swelling in the kidneys. So we do usually sonography also. Next, how do we treat it? So treatment again, like I said, on urinary culture report, we come to know about the antibiotic which helps. So we give an antibiotic, we give a urine alkalizer. So urine alkalizer means it increases the pH of the urine. As a result, the organisms which are there, they cannot survive. So they cannot survive in that pH. That is why urine alkalizer really helps. Apart from that, drinking good amount of water really helps. And then the symptomatic treatment, that means if there's fever, then we give crocin to treat fever. And if there is any prolapse or something, then you have to obviously treat it. Or if there's a stone, you have to treat that as well. So next, again, very important question. How do we prevent it? How is infection prevented? Women often have this question. They are actually in a dilemma that they're such common sufferers of urinary tract infection that they go really crazy. I have seen women, they go mad about it, that every week I'm having infection, I'm taking antibiotics, I'm getting better, but again next week I'm having the same thing. And this applies to the sexually active female to a great extent. In them, the rate of infections are extremely high. So what do you do to prevent it? See, again, most important thing in these females who have recurrent infections is hygiene. You have to have a very good hygiene. You have to clean the area every day while taking a bath from front to back. The direction should never be from back to front, it should be from front to back. Secondly, you must drink a lot of water if you are prone to infections. Thirdly, you must avoid using public toilets. That is quite important. You must empty your bladder very frequently. That means once you drink a lot of water, you will obviously pass urine more number of times. You should not keep the urine held up inside your bladder. You should keep passing it very frequently. Have juices, have cranberry extracts. Cranberry juices are said to be pretty good for urinary tract. So we usually start patients on cranberry juices or cranberry extracts. In sexually active females, it is very important to clean the area post intercourse. And if usually the male partner also should be using good hygienic practices. He should be extremely clean before as well as after intercourse. You should drink a lot of water on those days of intercourse and pass urine very regularly. And if possible, use a physical barrier protection during intercourse, because that leads to a lot of infection transfer from the male to the female partner. These were a few points about infection. Again, I am stressing over it again and again that drinking water really helps, drinking a good amount of water. It really helps the patients. So if at all you have any urinary symptoms, make sure you're emptying your bladder regularly and you're having water to a good extent. Again, these infections are more common in females than in males. If a male has urinary infections recurrently, usually there is some other cause in his urinary tract. There is some other structural abnormality, which is why we do a sonography to rule out anything else which is dangerous, in males. But we do the sonography even in females just to rule out any other cause. So after stones and infections, next I would like to move on to cancers. So urinary tract cancers, usually I say the cancers most common in the urinary tract is a prostate cancer, but that applies to men. If I have to speak to females only, cancers of urinary tract restricted to females are only the bladder cancer, that means urinary bladder cancer, and kidney cancer. Apart from these cancers, the testicular and the penis cancer are there, which are again applicable only to males. So the women-related cancers that we treat are the bladder and the kidney cancer. Let's initially speak about bladder cancer. So the urinary bladder is the part of the urinary tract which is quite lower down, which gets full, and that is when we feel like passing urine. So that part of the lower abdomen is where the bladder is, it becomes full when we are full of urine. So bladder, whenever there's any abnormal growth or a tumor which is growing inside the urinary bladder, it's called urinary bladder cancer. So what are the causes now? Frankly, when you speak about cancers all over the body, there is one thing: smoking. Smoking is always one cause. Smoking, tobacco chewing. These are the commonest causes of any cancers in the body. So it is quite harmful, frankly, smoking. So it's consistently seen that bladder cancers, are quite common in smokers. So if a patient has bladder cancer, most probably he may have smoked at some point. So, but at the same time, it also does not mean that, if you smoke, you'll definitely get bladder cancer. So, but yeah, more number of patients, if you see a bladder cancer, they are smokers. So smoking, tobacco chewing is quite common. There are certain occupational things, which are related to bladder cancer. That means the people who are working in industries of paints, paint, dyes, rubber factories, or even textiles or leather factories. The percentage of bladder cancer is seen more in these patients. Again, this does not mean that a person working in a leather factory will definitely have bladder cancer. It is just that the proportion is that patients, all bladder cancer patients, were screened. So it was found that these patients were more working in these factories. That's it. So these are the causes. Previously, if the patient has received radiotherapy for any other organ cancer, even they can have bladder cancer. Chronic urine infection, that means urinary tract infection for a very long period, that can cause irritation of the bladder lining, and that leads to cancer. Again, stone, which a patient may have a stone for a very long time, that is also a cause for cancer. One particular infection that I would like to mention is schistosomiasis, which is quite common in Egypt and Africa, in entire Africa actually. Schistosomiasis has led to a lot of bladder cancer related deaths in that continent. And lastly, it is quite dependent on the genetics, on the genes of a person. When I say genes, it means the chromosomes, the DNA, which is there inside each and every one of us. If the DNA has malfunctioned, has malformed, or has mutated, it will lead to cancer. So there is no cause for it, frankly, why these mutations occur and what, if there are problems in the mutation, in the chromosomal makeup of the person. There is no reason for it, really. So these are the causes of bladder cancer. How would you know that there is a cancer harboring inside the bladder? The most common symptom that patients have is blood in urine. They may pass clots. Now, at the same time, frankly, blood in urine does not always mean that the patient has cancer, because even a kidney stone patient will have blood. Even a simple urinary tract infection in female or male would have blood in his urine. So, but yes, if a patient has bladder cancer, he will almost definitely certainly have blood, and he will be passing clots in his urine. Apart from that, there will be pain during passing urine. A clot may obstruct the urinary opening. That will lead to retention of urine. In late stages of cancer, if it's spread to the other parts of the body, then there will be pain in the bones, in the spine, hands and legs. And that may lead to weight loss, decreased appetite. These are the symptoms if the cancer is spread in the body. How do you diagnose it? Again, sonography and a CT scan. And to see if the cancer is spread in the body, we do a simple PET scan to check its spread. How do you treat it? So nowadays, endoscopically, again, through the urinary passage, we go in and we remove the tumor from there. Now, after removing the tumor, it is examined under the microscope, as to what kind of tumor is it? Is it actually cancerous or not? And to what depth has the tumor gone inside the bladder? Based on that, there is further treatment as well for bladder cancer. It could be either removal of bladder, or it could just be a type of chemotherapy which is given only inside the bladder. So there are different treatments ahead. But first and foremost, the treatment is to go in with a camera or a scope, that is endoscopic treatment, and to remove the tumor from it. So this was about bladder cancer. Next, we can speak about kidney cancer. Now, kidneys are basically two organs situated in our on the back side, just below the ribs. Their main function is urine production. So they produce urine and they deliver it into a bladder through a very thin tube, and from the bladder the urine comes out. Now, whenever there's an abnormal growth in the kidney, it leads to cancer. Usually 95% tumors in the kidney, if you see on the CT scan, they are cancerous. Only 5% tumors are not cancerous, it is said. Now, what are the causes of kidney cancer? Again, smoking. It goes without saying, frankly, that smoking leads to this cancer as well. It is seen that patients who are a bit more obese, kidney cancer is more common in them. And patients who have increased blood pressure, I think they're taking medications for blood pressure since some time, they're also prone to kidney cancer. Apart from this, there are a few syndromes which occur in the body. The patient may be suffering from them. In them, the kidney cancer is quite common. One such syndrome is called VHL, von Hippel-Lindau syndrome. There are 10 different syndromes like this. We don't need to go in details of, or even the names of them, because they are quite complicated for anyone to remember. So apart from these syndromes, the genetics plays a role. Again, genetics, that means the chromosomal makeup of the patient. Like I said, if there is any problem in that, patient will have kidney cancer no matter what you do. What are the symptoms? Now, like bladder cancer, like I said, there's blood. Patient will definitely have blood in urine. But in kidney cancer, many times patients are absolutely asymptomatic. They have no symptoms until extremely late stage as well. So we see patients who come to us with cancer spread in their body completely, entirely, but they have no symptom. They are at their last stage of cancer, but still they have no symptoms. So this can happen in kidney cancer. Sometimes patients also have blood in their urine. So, blood in urine can never be ignored. It could be something as simple as a urine infection, that is UTI, or it could be something as dangerous as a bladder or a kidney cancer. So blood in urine has to never be ignored. Patients may have weight loss, or they may feel a lump, a big mass here, in the upper abdomen, behind and front, if the mass is very big. And if it spreads elsewhere, then again, the symptoms are very similar to the bladder cancer spread. That means the patient may have weight loss or loss of appetite, may feel weak. When I said that kidney cancer can have no symptoms, believe me, when I had patients who have just basic acidity, and somebody just prescribes them an ultrasound, sonography of the abdomen, just to rule out anything. And on sonography, they are found to have 10 centimeter tumors in their kidney. So, that's what I'm saying. It's such a big tumor inside the body, and you may actually have no symptoms. That is why it is said that, we must indulge in yearly health checkups. Every health checkup usually has a sonography. So if you're doing, you may be totally asymptomatic. You may have no symptoms, but you may be harboring a very dangerous malignancy or a cancer inside. That is why you should undergo regular health checkups. It applies to every male as well as female. So these were the symptoms. How do you diagnose it? When it comes to diagnosis, again, it's an ultrasound and a CT scan. A PET scan may be done, which will help us know the spread of the tumor. How do you treat it? Treatment, depends on the size of the tumor and the location, frankly. If it's a small tumor located somewhere in the kidney, then we remove only the tumorous part. We do not remove the kidney. Because it is a cancer and it has to come out. There are other means and methods nowadays in which patient without undergoing a surgery can get cured, but they are under experimental stage in India yet. So, but in India, as of now, the standard of treatment is surgery for small tumors. Even for big tumors who are occupying a large area of the kidney, in those cases, the entire kidney has to come out. But if the tumor is quite small, located in one corner of the kidney, then we don't remove the kidney, we only remove the tumor and the surrounding 1 or 2 centimeter of the kidney. So it's called partial nephrectomy. If if the entire kidney is removed, it's called radical nephrectomy. Now, these surgeries for bladder cancer or for kidney cancer can be done by 3 means. That means, you can, it's one of them is by a traditional method by taking a big incision on the body, a big scar. It will leave a big scar with multiple stitches on your body. That is open surgery. Secondly, it's laparoscopic surgery. When you say laparoscopic surgery, it's in layman's words, it's called laser, where there are 3 to 4 holes in the body, and through those holes, our instruments go in and we remove the kidney or the partial kidney. Thirdly, and it's come off lately, it's the most advanced form of treatment, that is robotic surgery. Kidney tumors can be removed, even bladders can be removed robotically with a real ease, with very good patient outcomes, with very less pain and bleeding, and with earlier discharge to the hospital, to home, from the hospital. So that is robotic surgery actually, which has come up recently. So this was overall about kidney and bladder cancer as well. Just I will take last 5 minutes to speak about prostate cancer, why I'm including this here, even though it is specific to males. But still, I wanted to include here because prostate cancer is extremely common in our country. And in fact, in the West, it is all the more common. In India, its incidence is rising to a great extent, and we should all know about it. Prostate is a small organ which is present in the urinary tract. It surrounds your urine tube, so it grows inside and presses on the urine tube and causes urinary symptoms in males. When it develops some abnormal growth, it leads to cancer. Now, the causes are again genetic causes and family history. If the patient has had a brother or a father or even a grandfather with prostate cancer, there are chances that he may have it as well. So prostate, this is the cause, and symptoms are urinary symptoms, difficulty in passing urine or absolute blockage of urine. There can be burning, there can be increased frequency of urination, especially at night. And to diagnose it, we usually diagnose with the help of an MRI and a biopsy. We have to do a prostate biopsy, and which helps us know what kind of cancer is it. Apart from that, we do a PET scan to see if the cancer is spread anywhere else in the body. When it comes to its treatment, in the early stages, nowadays surgery is what is prescribed. Surgery, again, open surgery, laparoscopic surgery, or even robotic surgery is there. Robotic surgery has special indications, special mentions for prostate cancer. The surgery as such is pretty difficult, but robot has made it extremely easy, and it has been adopted everywhere in the world now, robotic surgery for prostate cancer. So robotic surgery is the treatment for early stage cancer. If there is a late stage, there is hormone treatment, chemotherapy as well. Or even radiation has come up in a big way for prostate cancer now. Last sentence I would like to say is prostate cancer screening. That means, how do you detect it early? I said it's very common, so obviously we should all be in for detecting it early. To detect it early, there is a simple blood test called PSA, prostate specific antigen, PSA, which has to be done above 50 years of age in every man yearly. You have to do it in regular health checkups. Usually the packages, they usually include PSA. So PSA has to be less than 4, and usually higher values suggest that it could either be cancer or something else, but it does require evaluation if the PSA is high. So if you are above 50, you should definitely get your PSA done, and you should visit a urologist or a uro-oncologist to examine you. He will do a simple bedside examination. That, along with PSA, are the two things which are done in PSA screening, and it is recommended for every man above 50 years of age. So this was all about cancers, urinary problems, stones, infections in females as well as males. I really hope I have covered, I've covered everything in short because of the want of time, because I wanted to cover more topics. I hope I was very clear. I'll be really happy if you ask me questions. At least I would know that everyone was listening, and I'll be really happy to answer them. Thank you so much.
Thank you, Dr. Arun. Absolutely, you have covered almost everything with respect to the topic. So, and there was no dull moment, even though you have not showed the presentation. Everyone was,
Yeah.
I believe, stuck to the monitor and were listening to you. So, before we move to the Q&A session, we will be initiating the poll. Request all the participants to kindly share your feedback. While you're doing so, request all the participants to kindly post their questions in the chat window. Once again, I thank all our participants for joining our session today. We have received a lot of inquiry about the e-certificate offered by HRAI. You can claim your e-certificate by sharing your details, name and session attended in an email to the email ID provided in the chat window. Please ensure you do this by the end of this month. We will email the e-certificates to you based on the details received. We have received some questions in the chat box. The first question is from Bhavna. He's saying, sir, if gallbladder removed, what kind of diet needs to be taken, as I feel so much bloating in stomach and feel acidic many times?
So thank you for the question, Ms. Bala. So your question is about gallbladder. Now, we actually spoke about the urinary bladder. There is a difference between urinary bladder and gallbladder. A urologist deals with urinary bladder, which I covered, but a gallbladder is dealt by a surgeon, a general surgeon. So this is outside my area of expertise. Frankly, my area of expertise is urinary bladder, but I will still answer your question. Gallbladder, it stores bile. It's a fluid which is required for digestion of fats in our body. So if a gallbladder is removed, that bile which comes, it takes time to come in. So as a result, the fatty foods may not get absorbed properly. That is why surgeons usually advise that if gallbladder is removed, you must avoid having fatty diet, with a lot of ghee, butter, and all these things. You must avoid fatty diet. That's all I can suggest. But I think a general surgeon is a better person to answer this question.
Thank you, doctor. So we'll move to the next question, that is from Nidhi. She's saying, what precautions should individuals with kidney stones take to prevent complications?
For complications, see, stone-related complications are what? It may, over a prolonged period, if there's a stone in the kidney, it leads to non-functioning kidney. Your kidney becomes not functioning. So to prevent complication, the precaution that you can take is get it treated as soon as possible. That is the only precaution you can take. Yes, but if you ask me what is to be done to prevent stone formation, then I have already mentioned you have to drink lots of water. You have to empty your bladder frequently. You must have diet which is rich in calcium, low in oxalate. You must avoid caffeine, tea, and even beverages, that is soft drinks. They can also lead to stone formation. Excessive vitamin supplements can cause stone formation. A very good amount of calcium in the diet, like milk, buttermilk, curd, all these things, they help. And the oxalate should be low in our diet. So you must avoid foodstuffs which are rich in oxalate, like dark chocolate, black tea, cashew nuts, peanuts, spinach, potato, and soybean. These are the things you can do. But you ask me what precautions should we take to prevent complications? Complication is non-functioning kidney. That is the complication. So to prevent that, you have to get it treated. You can't leave a stone inside your body for too long unless it is too small. That's it.
Thank you, doctor, for answering this question. We have received some questions from the registration, so I'll just call it on. The first question is, what are the recommended hygiene practices for individuals with urological conditions?
So hygiene, it will only help in preventing infections. I already spoke about it. So when we speak about hygiene, the area near the urinary opening should be very clean. You must clean it every day with soap water while taking a bath. That is very important. Women specifically, the entire area near the opening of the urinary tract and the vagina has to be cleaned thoroughly. The direction of the cleaning should be from front to back and not from back to front. That is important. Having lots of water, it helps because if infections are there, they usually get flushed off as you have more and more water. You must empty your bladder very frequently. In sexually active females who are having infections after intercourse, in them these hygienic practices, they really help. You must clean each and every time after an intercourse, as well as the male partner should do that before and after intercourse, and drink lots of water on those days. These are the basic precautions that you need to take.
Thank you, doctor. The next question is, what precautions should individuals with bladder cancer take to manage their condition and prevent recurrence?
To prevent recurrence, you must follow your doctor properly. You must go on regular follow-ups, because whenever we remove the tumor, whenever we treat any tumor in the body, there is always a fixed follow-up protocol that you have to follow. So when you suppose if we are calling you for a follow-up after 3 months with the recommended tests, you must do those tests and come back to us. Many times patients feel that मुझे कुछ problem नहीं है, I am fine, तो मैं क्यों जाऊँ? I won't do the test. That's what they think. But cancer may or may not always produce symptoms, frankly. Usually it produces symptoms only when it is too late. So you must go on follow-ups regularly and get checkups done, whatever has been recommended by our doctor. And otherwise, there is nothing else that you can do to prevent it. You can only detect it very early and treat it early. But to prevent it, you must avoid smoking. That's all I can say. Smoking can cause any of these cancers, really. So avoid smoking, yeah.
Thank you. So we'll go with the last question. That is, what precaution should individuals with an enlarged prostate take to manage their conditions and prevent complications, if any?
When a prostate is enlarged, see, what we normally do is patients have a tendency to strain a lot. So you must avoid straining, because straining in fact increases the problem. It is better you go to the urologist and take a simple medicine which is even usually taken at night time for prostatic problems. Otherwise, precaution wise, there is nothing. A prostate will increase in size in every male, because a male's body is designed in such a way that the prostate has to enlarge, because the male body secretes testosterone, and testosterone itself leads to increase in prostate size. So the prostate will definitely increase. There is nothing you can do to prevent its increase. But if you have symptoms, you should visit the doctor as soon as possible, because the symptoms are treatable with simple medication. If with medication it does not help, or if there is urine retention, then you may have to undergo a simple surgery. But otherwise, it is usually managed well by medicines.
Thank you, doctor. We have received one question in the chat box from Tushar, saying that apart from surgery, how to get rid of stone sizing between 3 to 5 mm?
So stones of 3 to 5 mm, they don't need surgery. Firstly, usually they don't need surgery. 95%, 99% times. Usually such small stones, they usually come off on their own. Very few patients, they do not come off. in them, surgery is needed. Now, how do you get rid of them is by drinking lots of water. I said kidney produces urine, and that is where stones are formed. So if you have more water, there will be more urine formation, and the stones will easily get flushed off. So having lots of water and preventing infections, that means, even if you are burning, you must immediately visit the doctor and start the treatment. So, that will help in ultimately in removal of the stone as well.
Thank you, Dr. Varun, for answering all our answers so clinically. And thank you for this insightful and highly informative session. It has been a pleasure being with you today. I am sure our participants had a lot to learn and take away from this session. Before we conclude today's session, we would also want to thank our event partners, Geisha, NASCOM COE, LinkedIn Local, Talgro, TLE, and WICCI for supporting these HRAI events. To know more about them, request you to kindly visit the links provided in the chat window. Thank you once again, dear speaker and our participants, for joining us today. Do join us for our next event, Connecting the Dots, on the topic, The Future of Artificial Intelligence, on 6th April 2023 at 3 p.m. That's it from our today's webinar. See you soon. Stay safe, take care, and bye for now. Thank you, Dr. Varun.
Thank you. Thank you so much.